So we're going to show a quick demo on how to treat functional dysfunctions versus respiratory dysfunctions. We did the overview video of just showing the assessment with the treatment of just working into anterior depression. Now I'm going to briefly review that, but then show you options of kind of where your hands go and how to treat the other three as well. So we'll start with what we did before. So basically I am taking the ulnar side of my hand, kind of getting a lumbrical grip into her armpit and getting, so I have a contact on her scapula and humerus, and then I can bring her back into posterior elevation. And then I will, again, that assessment is the 3-point. Let's say I find it here, and then from here I just block and have her breathe and out. Good. And then in the other video, I showed a variation for going into upper extremity basking seal. So you can watch that for that. If I'm going in the opposite direction, I'm coming into anterior depression of the scapula, and then I would actually take my thenar eminence broadly across the ribs to bring them up and back. And this would be to help with left rotation. So I could do the same thing here, breathe in and out. Good. I could also have her press up into my hand. So press up, and that engages those ribs as well. And let it go. So that's the second option there. Okay. Now, the next thing that I would do here is go to the pelvis. And now we're using the pelvic pattern of anterior elevation, posterior depression. And if I bring her pelvis down into posterior depression, now I am spring testing up and forward. And let's say I'm on a rib here that I want to be on. So pelvis, posterior depression, rib up and forward. Breathe in there. And I'm blocking it up as she breathes in and then out. And I'm keeping it up as she breathes out. So go ahead and breathe in. I'm following as she breathes in. Good. And out, I'm keeping it relatively up. Good. Now, other things that I could do here. I could actually use the upper extremity basking seal again to help with this motion, which is probably what I would use. I'll take the pillow away. That works. And then keep your head neutral. I'm going to bring her into posterior depression to lock out all of the myofascial structures here in this diagonal. And then I'm going to get on the infill that I want to, and then breathe in. Good. Follow it up. As she breathes out, she's dropping down. Good. And breathe in. And come up and out and drop down. Good. So we're using the breath and the motion to help to open up the rib cage and breathe in. Sorry, we're going backwards. But basically what you should do here, ideally, is as they're breathing in, and I'll just show that one more time. But as they're breathing in, so come up here, as they're breathing in, they're dropping down. Like that. Okay, so she's breathing in, the ribs are going up and forward. She's also using her body to assist with that motion. Okay, and then as she's coming out, she's coming up, and I'm blocking it up and forward relatively. Okay, now with the pelvis, we bring it into anterior elevation here, and we want to do kind of a mass kind of shortening pattern from PNF world. So now I'm bringing her back here, and now you can put your hand behind your ear again. And now, as you raise up, you would breathe out. So breathe in, just being neutral, and then out and raise up there. And then breathe in, drop down just a little bit. And I'm blocking that, and then out and raise up. Good. And I might actually come in here with this kind of grip, and then breathe in. Good. And out and drop. So I'm trying to get this whole side body to shorten with that technique. Okay, so that's the 4 general techniques. Blocking from the pelvis for respiratory, blocking from the scapula for rotational or functional, and just kind of how you position your body, how you position your hands to then mobilize in a general way.